Hello, I'm Dr. Tanya. Today we have got an amazing person from UK. I'm going to get him to talk about what he does and introduce himself to all of us. We are so eager and so keen to hear a lot of things from UK from this lovely doctor. Hi, Dr. Sogy, how are you?
I'm fine. Thank you so much for
Can you
inviting
please
me
tell
for this small talk.
about yourself for the viewers, please?
Thank you. My name is Dr. Sogy Alex Tachinkari. I'm a general practitioner or family practitioner working in England, north of England, Yorkshire. So that's my job. I'm practically working as a general practitioner for the last 15 years. I'm from Kerala, did my basic degree from Kottayam Medical College, did my surgical training, got a fast years, and then came to be a general practitioner afterwards.
Fantastic. So we are facing such unprecedented health situation, health crisis now. I don't think none of us had anticipated this. And I'm sitting in Australia and I'm looking at the current situation. We are doing tremendously well, and we have actually done really well for the last few weeks. And then we look at our fellow countries, our beloved England, and it's worrying, sitting here looking at the numbers and everything. What is your perception? Like, how are you all coping over there? Just really interested to know that.
Yeah, it's probably in my lifetime also I'm facing something like this. In a nutshell, or in one word, it is really worrying and anxious moments for us. I'm sure you might have seen the news. There's lots and lots of deaths, because for a country like England, which is very small compared to many other countries like India or Australia, we almost had 30,000, nearly 30,000 deaths. So that includes, even few of our friends we know personally. And, that adds to the anxiety of the situation. You don't know what is out there for you as a person tomorrow, especially when you work in medical sector. So it's anxious and worrying, to be honest, and we are still just going to the peak. Hopefully we are slowly progressing or getting better. That's what it's scary times.
Yeah, see, I worked in England and I know human lives are being, given a lot of value there. It's a country where we value human life, we value everything. And sitting here in Australia, leaving England several years ago, it is heartbreaking for us that when when everyone in the medical facility try and fight to save one life, so many lives being lost. So as medical practitioner, working midst of all this situation, it must be very stressful for the doctors there. How are you all handling? Is there any help available for doctors?
You see, if I'm sure the doctors means there are a lot of different sets of doctors. We work in, me as a doctor work in primary care where you directly come in contact with patients. You've got lots of other doctors working in secondary care in different departments. But if you think about it, I'm probably lucky, in general practice, we have managed to a certain extent the direct exposure to patients by using telemedicine, telephone consultations, etc. The biggest challenge is for the doctors who work in probably very close to patients in ITU, mainly critical care consultants. And for us, the challenge is slightly different, and it's different for different sets of doctors. So it is scary. We all were worried so much when in the beginning because of the we hear about the deaths. We were not sure what exact protective equipments we should wear or at what type, like type and what circumstances. So there were lots of confusion, especially you're losing your friends and probably people right, left, and center. So it is, it's not easy. Especially we are old, like I'm a 50-year-old person, so when you get to that age, there is lots of, small medical problems. So your family is worried. You come back to your home, then you go to your wife or your children. So it's all pretty confusing and complex, and nobody knows the answers. So we are slowly, getting used to this new world where there is lots of sorrow and pain, to be honest.
It's funny when people look at doctors or think about doctors, they think that, yeah, they're doctors, they're fine, but we are not immune to any of this. And we do also carry medical problems. We do have medical issues. We have immunocompromised doctors around. We have people who have been undergoing chemotherapy who still come to work. And not much we actually think about it, but that is the real world. Anyway, I was looking through some messages and I saw that you received tremendous amount of phone calls from different communities and stuff regarding COVID. So it must be quite scary situation for patients, for people out there, isn't it? Like the rising spread of COVID, social isolation, restrictions, lockdown. How did you handle those calls? How did you manage? And I'm sure after each cause, which I know from my experience, it does leave a little bit of an impact on us. And if we carry it home, no matter what we say, we do carry it home. We carry the burden or the stress that people have, we carry it home. How did you handle that?
You see, what I did as a doctor, I'm a general practitioner, so I work 4 days in my GP surgery where I take my own patients, talk to them, so they know me a little bit. So that's slightly easy. What I did at the same time was trying to create a small support system for people from India, mainly from, Malayalam speaking. There's quite a lot of doctors, nurses, and other health workers in the UK. So we just started up a helpline, a website, trying to take that calls as well. So it was practically, in a way, it has helped me because, I didn't get that much time to think and worry too much about myself. When you hear horrifying or horrible stories of your colleagues, your friends, who, yes, the worry of the negative impact of economy, downturn, that's a big thing. At the same time, the lives are lost. That's a different ball game altogether. You are not sure what you're going to listen tomorrow. And, we've been, I was doing this call center and we took quite a lot of calls, very people from different parts of UK. One call was, just for example, a person who was actually was a worker, a Kerala person working in a cruise ship. He landed in Southampton, one of the ports, where they contracted COVID. It's very serious. Admitted to the Southampton hospital where he was ventilated. Nobody knew who he was. Practically, the only thing was he had a wedding ring, which one of the nurses who were working in the ITU identified. He's probably a Keralite. They tried to track him, and we tried to contact with his wife. So when you are involved in that sorts of work, you practically, it is busy, but it gives you a little bit of probably a distraction, probably thinking not to think too much about what is out there, probably waiting for you to be one of it can be, you never know, because you as a doctor, as a GP, you work, you talk to patients, you don't know who you are, you can't really protect us, keep in a shell, practically you are exposed. So there's always that danger. But possibly after first few weeks we felt that possibly we may be able to manage it, because the support was little bit more from the government, because they were also confused. You can't really find fault with government. They've done whatever they could, but it is probably could have been done better. But there's no point in picking that. But now the things are getting better. We all get enough, and possibly most of us. I'm not sure. There are probably other pockets where PPEs, the equipments, the ventilators, but they have done well. Unfortunately, we all know that the COVID is very unusual. You can't really physically, very minimal. You can, treatment-wise, minimal. It is support mainly. There is quite a lot of people, especially people in nursing homes, for example. They've been old age, all the other risk factors, and they land up in ITUs. Lots of them, they've lost, one nursing home lost around 70 odd elderly patients. So it's not, it's just beyond your words, how to express that sort of feeling. You can't really you can't really explain it in words, to be honest. So I would say the coping mechanism is, you look at your own peers working and hoping nothing will happen, and most of them, survive, luckily. So we are still in the middle of the problem, so we don't know how the next day is going to be like. Initially, we were worried, whether, because we all worry whether should I go to work? That's a genuine question everybody asks, should I or shall I? But most of the doctors and nurses, I have to say, amazing. I had such a amazing team of nurses. You won't believe, how much commitment, ready. Probably much more than doctors. They are there right in front.
Yes.
Minimal supports, but they have taken such a responsibility. They fought it out. Yes, there were really bad stories as well. Few of them lost their, it's sad stories. If you think about it, people start, prayers, everything, spiritualism, everything has really, possibly, I would say, possibly people started to thinking about God more, because most of the time you find, there are no clear answers. You're waiting, hoping that this person is going to get better, but sometimes.
Yeah, you said very important thing, that is how much nurses have contributed during this unprecedented situation. They have, I agree, and that's what I'm seeing as well. They're doing amazingly well, and they've actually they've become angels, like, willing to help, stepping up and, putting themselves out there.
You
That's
see,
really
Tanya,
commendable nursing profession.
Yeah. See, I was just talking to one of the nurses. It's really a touching response she has given. I asked her, you don't have enough equipments, but you still go out and, this is for the, she's working as a carer in community. And, she told me that, the doctor, I don't know, but if my name is there in the book of life, I will survive. So I'm not worried about the, whether there is PPE or I don't, I know that there is a person or there are a few people waiting for me to be supported. So I'm not going to shy away from that work. I'm going to go. I don't know whether I'll survive. So that sort of commitment when you hear. Yeah. See, I sometimes feel I'm very privileged. I'm in a cocoon where lots of protection in the system, financially reasonably well off. We can manage our life. But for these people, it's not a small, simple. It's more than life, I would say. They got their mortgages, their cars, their loans and credit cards. So it's a sad story, to a great extent.
Totally, and it's commendable that they themselves have the medical problems. They have families, that husbands or partners who have lost jobs, and they're still putting themselves in front. They have young children, and they're still willing to go from house to house without their protection or anything.
You see, and lots of this nurses especially, and healthcare workers, because there is a balance here, because you want these people to be there to help other people, but because of the fear, lots of people are taking leave. There are not enough to cover these problems.
Correct, yeah.
Then comes a massive question for these people, whether I should go to work even with my medical problem. They, like they have to come back to their husbands, or probably other health issues there, or children. So it's a ever-ending problem. Like employment issues are massive, because they're fearful about their line managers asking lots of questions, how they can prove or disprove whether they are what do you call the patients who needed to be, there are type of people who should be shielded from direct exposure. So multitudes of, you know, uh, questions which even as a GP who usually deal with on day on, we don't have answers. We have to find it out. What are the possibility of a patient who is on, like insulin with HbA1c, or the control is not very good. What should I advise? Do I have to ask him to sit at home, or whether the hospital or the place where they're working, they ask them to come? So there's no guidelines, no clear cut, uh, you know, standard protocols, and we are all confused to a great extent. But it's getting better now, I have to say.
Yeah, you nailed it. We are all confused worldwide. All of us are confused about what's going on, what's going to happen. Are we going to face a worse second or third wave? And what are the post-virus problems? Is it going to leave us with anything, any after effects of this virus on our system? There's so many questions that's been unanswered, and even the nature of the virus, how it attacks a body, and also the question still remains that why are some countries doing better than the other countries, like countries like your country in England and America, as opposed to, and Italy, and Spain for that matter, and compared to that, like countries like Vietnam. So it's amazing, like how the death rate varies. Have you got any insight? Do you know why it's happening? Why it's?
I think it's. I have to say, if you think about countries like European countries, see, there are no clear answers. Even I don't know. Everybody is probably looking for answers. But like if I compare my own state, Kerala, with or Cochin Airport with Heathrow Airport, which is one of the biggest airports, as you probably know. The number of people landing there, visitors. It's so many. So if like the comparisons have to be like to like. So that's probably one reason. I'm sure on hindsight we should have taken much more stricter or quicker decisions not to. It has gone beyond control now. So there should have been. Yeah, it is all hindsight. Yeah, but now, looking back, yes, that's probably one reason. There are lots of people travel there for holidays, the number of people visiting. So America and England, probably one, and Italy, if you look at it, there are three major countries affected very badly. Germany doing reasonably well compared to other countries in Europe. Spain has done badly. So you see, there are no answers. The only, yes, it is. There are probably lots of people thinking about it. As a small doctor in a small village practice, what I'm worried about is, how this is affecting, people around me. I may not be able to change, the big picture. Maybe the small.
Sorry to interrupt. I was just asking, when you said when you are dealing with day-to-day issues and stuff, you're going to probably be facing a lot of mental health problems and crisis during, and if not more after, because of the economic situation, job losses, men's mental health, which is huge, because naturally that's a lot of people have lost job, and we don't address that enough, like how men cope. Men's health is an important topic. yeah, and of course, women's health and children. I'm not saying that's less, but as a general practitioner, as a male doctor, probably you will have men talking more about um, the mental health problems to
Yeah,
you, being a man doctor. So I'm just curious, is that what you
yeah.
predict as well? A lot because of the
Yeah, I think there is
financial.
lots of mental health issues associated. There's no doubt about it. If you look from a male perspective, the biggest worry as far as the general perception is, yes, males have lost more life compared to females or children. And if, in England especially, there is clear evidence that young men has also, because sometimes they say it's, like in 95% of people who affected by corona, it is a small, simple flu-like symptom. You get it, it goes away. But that 5 to 2% of persons who get it bad, there is quite a lot of men affected, and there are not that age group, other illnesses, but there are lots of young men lost their life as well. So that is probably one of the most important. Then that adds sort of massive amounts of worry. They come back to, because general practice is the main area where your here system is, it's a welfare state. GPs are the gatekeepers. The service is completely free, so they clog the system, there's no doubt, with lots of questions and worries. But most of them are lucky that they're healthy, active. So that's to a certain extent we weed out the worries and anxieties. But we do, like occasionally, it's not common, I have to say. I haven't come across an young person getting or admitted into the hospital. So that itself gives you a confidence that, yeah, it is there probably. As a population, it's still significant, but, for small practices like ours, it's not a major problem as such. So that's, I would probably say. Then, of course, if you think about, the work, type of work men do, mainly construction jobs, and they're all practically gone into, and there are lots of self-employed people. The financial situation is really bad, so that's probably prompted them to go on to, because it's being a welfare state, people go on to lots of, the government support systems, stop working, alcoholism, smoking. So that becomes a vicious cycle. So it's a difficult situation, yeah. We can't completely blame the system or them. It's a difficult system for, or situation for everyone, yeah.
What does the Royal College stand on hydroxychloroquine?
Yeah, hydroxychloroquine, there's lots of news around it, but, in England, it is not at all used in any form. They say sometimes in, like as a trial in intensive care units, sometimes used. So it is not at all used for prophylaxis. It is not used for treatment. And in some centers, there are some studies going on. So as one arm of the study, they have started using it, but it has got no evidence to support to use in primary care or for the symptoms or any other, like prophylaxis. No, so it's not used.
Perfect. Thank you so much. Thanks for joining, and love chatting with you. I miss England. I miss the beautiful country towns there. I just hope now that you all stay safe and healthy. Enjoy your weekend. Okay.
Thank you so much, Tanya, for giving
Take
me the
care.
opportunity. Okay.
Yeah.
Hope.
Well, it's great to have, it's great to talk to you, to understand the ground situation, and being a family doctor myself,
Yeah.
it's important to know,
Sometimes.
how our colleagues are coping with it all, because you put yourself out there not knowing whether you may get it or may not get it, which is, but
Yeah.
we still are.
That's it's so scary. That's the anxiety. You never felt in your life, because you know that there are ischemic heart disease, sudden deaths. But it can happen to anyone. But this is real. It is there, out there. You can't identify it, and that makes it so complex. Sure.
Sure.
The psyche of you as a doctor, the patients, and the carers, and the entire system is hesitant, anxious, and worried what to do next. So it's confusing what's the future going to be.
Yes.
So that's another big question we are trying to answer, hopefully.
Or what we can say right now is we got to stay positive. We have to look forward for better, better new beginnings and reset and restart our lives again. Thank you. Enjoyed the chat with you. Thank you, Doctor.
Thank you, Tanya. Thank you so much.